Let's talk about a tiny, butterfly-shaped gland tucked away in your neck. It might be small, but it holds a huge amount of power over how you feel every single day. Yup, it's the thyroid, your body's master switch. And today, we're going to demystify what happens when that switch starts to go haywire.
So does any of this sound familiar? You know, that bone-deep fatigue you just can't shake no matter how much you sleep? Or maybe weight that seems to creep up or fall off for no reason at all? Or just a constant feeling of anxiety, like you're not quite yourself? These aren't just random feelings. They could actually be signals from your body, and a lot of the time they point right to your thyroid.
So, what exactly is this thing? Well, think of your thyroid as the thermostat for your body. It's the master regulator. It pumps out hormones that control your metabolism, how fast you burn calories, your energy levels, and even your heart rate. When it's working just right, everything runs smoothly. But you know what happens when it doesn't?
That's when we get into thyroid disorders. It's when that master switch, that thermostat, malfunctions. It might start producing way too much hormone or maybe way too little, and either way, it throws your entire system completely out of whack.
It really breaks down into two main issues, kind of like two sides of the same coin. On one side, you've got hypothyroidism. That's when your thyroid is underactive. Everything slows way down. You get fatigue, weight gain, maybe some hair loss, and you're always cold. Then, on the complete opposite end, you have hyperthyroidism. That's an overactive thyroid. It speeds everything up, causing anxiety, weight loss, a racing heart, and you just can't stand the heat. Two totally opposite problems, all coming from that same little gland.
And it's not just about hormone levels. Sometimes the thyroid itself can have physical issues, like developing nodules, which are little growths, or a goiter, which is just a general enlargement of the whole gland. Now, these aren't always a problem, but they can mess with thyroid function, so they definitely need to be checked out.
Okay, so how does your body actually tell you something is wrong? You can think of these symptoms as your body's check engine lights. They're warning signs. So let's dive into what you should be looking for.
This list really covers the big ones. We're talking about those weight changes that you just can't explain with diet or exercise, that deep fatigue that sleep doesn't seem to touch. You might also notice changes in your hair, your skin, or your nails. Or maybe it's more of a feeling, like constant anxiety or a heart that's beating too fast. Being unusually sensitive to heat or cold is a huge one, and so is any kind of swelling in your neck. These are the key signals to really pay attention to.
So recognizing the signs is step one. But how do you actually get a real answer? The good news is there's a pretty clear and straightforward path to getting a proper diagnosis. Let's walk through it.
Getting to the bottom of it is a really systematic process. It almost always starts with simple blood tests. These check your hormone levels, specifically things called TSH, T3, and T4. If those numbers look off, your doctor might order an imaging study, like an ultrasound, to get a good look at the thyroid's size and structure. And finally, a physician takes all those pieces of the puzzle and puts them together to give you a complete picture and a clear diagnosis.
And here's the most important part. Getting a diagnosis is not the end of the world. In fact, it's the beginning of getting back on track. The really great news is that these conditions are highly treatable, and the goal is always lasting well-being. Your treatment plan is so much more than just a pill. It's a personalized 4-part strategy. It starts with getting the medication right, which might take some adjusting. But just as important is ongoing monitoring, regular blood tests to make sure everything's on track. Then there's lifestyle guidance for things like nutrition and stress. And finally, coordinated care, which means getting you to the right specialists if your case is a little more complex. It's a whole-person approach.
And this, right here, is the key takeaway. It's truly a message of hope. With the right care plan and consistent management, living a full, healthy, and balanced life isn't just possible, it's what's expected. It's the goal. All right, now for the fun part. Let's tackle some of the most common questions, the ones that pop up as soon as someone gets a thyroid diagnosis.
First up, the big one. The question that's on pretty much everyone's mind. Is this a lifelong thing? So the straight answer is, for many people, yes. Especially if you have an underactive thyroid or hypothyroidism, it's typically an ongoing treatment. But, and this is a big but, every single treatment plan is personalized. It's tailored exactly to you and your body's needs.
Okay, next question. Let's talk about food. Can you eat your way to a healthier thyroid? What's the deal with nutrition?
This is a really important one to understand. The answer is a bit nuanced. Diet alone can't fix a true hormone imbalance. But good nutrition is absolutely crucial. Think of it as the support system for your treatment.
Eating well helps your body respond better to medication and just improves your overall health, which is a huge part of feeling.
So, we'll end on this thought. All those subtle feelings of just being off, they're not always in your head. They can be really important messages from your body. So the question I want to leave you with is this. If you're feeling off, could it be that your body's master switch is trying to tell you something? Something that's worth listening to?